13 News at 10.
Tonight we continue your team coverage of the coronavirus and how it's affecting not only the world, but us right here in the Mid-South. We'll see how the campus of Ole Miss is going to look once some students return from spring break. Also, how safe are our pets during all of this? But first, let's start with a live report from Fox 13's Kirsten Garris. Kirsten? Actually, let's start with this. New at 10, we continue to learn more about the coronavirus. Health experts say it's important to keep testing for COVID-19. In states, especially like Ohio, that's where health officials are estimating as many as 100,000 undiagnosed cases. Fox 13's Kirsten Garris is live outside of Baptist Memorial Hospital right now. Kirsten, health experts are telling you there's a chance we may have a lot of undiagnosed cases right here in the Mid-South.
Yeah, doctors say we have to prepare for this virus to infect more people. But unlike Ohio, Baptist Memorial Hospital staff say we haven't had any cases of community transmission of COVID-19 in our area.
That by the time you document community transmission, you may just be testing the tip of that iceberg. So you have to count on there being more virus in the community than you know about.
Dr. Stephen Threlkeld is an infectious disease specialist at Baptist Memorial Hospital. Right now, he says community transmission of COVID-19 hasn't happened here in Shelby County. But he says there's always a chance there could be some undiagnosed cases. According to a 2017 CDC report, whenever 2 people are infected because of community spread, you can then assume that 1% of your population has it. In the Mid-South, there are 12.8 million people between the 3 states. That would mean roughly 128,000 people would be infected.
We have to be prepared for this thing to infect a significant proportion of the population. Part of what's going on, though, is we're trying to prevent it from going through the population extremely quickly.
That's why Threlkeld says some of these mass closures are reasonable.
By stopping some of the large-scale gatherings, it may be that we can, the term blunting the curve has been thrown around a lot lately. That just means that there's going to be, for example, a round number, 1,000 cases. It's much easier to deal with that as a system in healthcare if that's spread out over 6 months than if it's over 1 month. So you don't have as much strain.
Dr. Threlkeld says now there are 3 commercial labs that are offering COVID-19 testing. He says that will relieve some pressure from the state labs. Live in East Memphis tonight, Kirsten Garris, Fox 13.